At first, welcome to the ENDOTALKS live study club, live show, dear my friend Talal. Could you please introduce yourself a little bit for my followers and especially for my students?
Okay. First of all, thank you very much, Mustafa. Really honored. My pleasure to be here, one of the speakers. Actually, I'm following your episodes. It's one of my favorite episodes because I learned a lot from you and from all the speakers. You always keep working with a high level. So it's my pleasure to be here, one of the speakers to speak about, or to discuss, let's say, about the broken file removal. For those who does not know me, my name is Dr.Talal Al-Nahlawi. I am Syrian, from Syria. I graduated from Faculty of Dentistry in 1999, so almost 24 years of practice till now. And I obtained my master's degree in 2004 in endodontics, and then I completed my PhD in 2009. I've been teaching as an assistant and then confirmed to associate professor at Syrian Private University and a part-time lecturer also in Damascus University, Al-Sham Private University and National Dental Center. And this is my academic part. My clinical part, I'm practicing endodontics in my clinic. Basically in Syria, most limited to microscopic endodontics and restorative dentistry. And also I'm part-time or a consultant practicing in Abu Dhabi, Harm Medical Center. And also I'm doing courses, presentations worldwide, as you know, my friend.
Thank you very much, my dear friend. It's great to know you and it's great to learn something from you, dear Talal.
My pleasure.
Now, Talal, you are really famous for lecturing about these broken files in the root canals. And when there is a lecture, when there is an endodontic conference, there are two important names are always important. One of them is Yoshi Terauchi and the other is Talal Al-Nahlawi. I think I can pronounce your surname.
Yes, almost Nahlawi.
Okay, dear friend.
So we send regards to our friends Yoshi also as well.
Yes, we are sending our best regards to him. Now, I don't want to take your much time, Talal, and I want to ask my questions.
Yes, please.
So, when to remove broken file in a root canal, dear Talal? What is your prognosis of a tooth when a file is broken in the root canals? When do we have to remove it, or when do we have to bypass it? How do we decide?
Okay. Because first of all, it's a very, very important question. Let's agree on something very important. It's better to have a case without a broken file than having a root canal with a broken file. And actually, what does the broken file do exactly inside the root canal? It is not more than a mechanical obstacles. We have to think about the broken file in this way, because sometimes unfortunately, we as a dentist exaggerating too much about the incidence of a broken file, transmitting this fears to our patients. So unfortunately, we have a lot of patients came to our clinic. Please, I want you to remove the broken file. Another dentist discovered a broken file. I'm afraid that it may cause a cancer for me or to harm me, or to make any harmful for me. So this actually came from us as a dentist, because we are very much afraid of this incidence. And I will tell you frankly why. Because it can be seen on x-rays. And that's why, because it can be seen, so people will start speak about the broken file, and I don't want my patient to know about this. So for this, I'm too much afraid of this action. So first of all, let's agree that it's an accident. It's a complication that can happen during our root canal treatment. So don't be frustrated. First of all, me, myself, and I believe you, Mustafa, we break a lot of files inside the root canals while we are doing instrumentation. And this is something expected because we are practicing. And you know, according to literature, the incidence of file separation with the endodontist is much more comparing with general practitioner. So you will tell me, oh, I believe the endodontists are much more skillful comparing with GPs. So why we have much more incidence? I didn't mention the percentage. I mentioned the incidence, because they are doing a lot of cases. For sure, they will have a lot of cases of a broken file. But if we go for percentage, for sure, endodontist, skilled dentist will have less likelihood or less percentage of file separation. But having a file inside the canal is not the end of the world. It is not more than something preventing me from cleaning what is apically. And always I keep mentioning or giving an examples and comparing between the incidence of a broken file and the status of having a ledge inside the root canal. And I can assume that they are almost the same regarding the outcome. Both of them are preventing me from reaching the full working length. So first of all, it is something that we have to deal with it correctly and not to have too much fear of it. Now, going to your question, what should I have to manage? Which is a very important question. Shall I remove it? Shall I leave it? Shall I bypass the broken file? Actually, as I started my speech today, it's very important to try not to have the broken file inside the canal, because the disinfection will be better. Imagine if you want to clean the room, it would be better if you don't have the chairs, you have the table, so you will be able to clean in a perfect way, rather than having them, I'm trying to clean between them. So this is the main idea in the first phases. If we can remove the broken file for the disinfection. But is it the reality? Is it the case that we are having in all? Can we all remove a broken file? As we know that we need microscope, we need magnification, we need tools, which is the ultrasonics and other systems, and we need the skills. If we don't have them, so it would be better to go for the alternative option, which is the bypass. And even if we are skilled in the removing of the broken file, the bypass always also is a choice when we are not able to see the broken file. I know that Yushi has a lot of techniques about how to remove a broken file. Beyond the curvature, we are waiting more to see more clinical evaluation, especially, you know, that sometimes it will need more removal of tooth structure, and this, I believe, it will affect the prognosis. And also it needs special skills, not the skills, special skills from certain persons, so it is not something that could be dominating for everyone. So a bypass option is still an option to manage or to try to clean the areas behind the broken file where we are not able to see the broken file. It is apically located beyond the curve, or we don't have the skills and the armamentarium in order to do so.
Now, dear Talal, I am checking the questions that are asking me on my WhatsApp. One of my students is asking that, do we have to be an endodontist to remove a broken file in the root canals? Can a general GP also remove the file in the root canals? What do we need for it? What is the mandatory device for removing file from the root canals? He's asking that, dear Talal.
Okay, send my regards to your students because it's very clever. Actually, it is not something exclusive for endodontists. If you go back for my speech, I mentioned endodontists and the skilled GPs, which means that if you have the passion to do so, if you have the will to, in order to try to remove a broken file, you will do so. I will give you a very simple example from reality. When I did my postgraduate studies, it was in 1999, 20, something like this. In my department, in the endodontic department at that time at Damascus University, we didn't have microscope. So when I was graduated as a master degree, holding a master degree in endodontics, I didn't remove even a single file. Yeah. You will be astonished because I didn't have, at that time, at my period, we didn't have a microscope. We didn't have an ultrasonics. But after that, I worked over myself. I trained over extracted tooth, and then I was able to remove a broken file. So this is the first part of the question. It is not mandatory to be a professor or to be an endodontist in order to remove a broken file. This is the first part. But the second part of your question, what do we really need? Actually, it's very important. We all agree about the importance of seeing a broken file. You will not be able to remove a broken file without seeing it. Otherwise, you will have a lot of catastrophic results. And a lot of cases, when they are referred to my clinic, unfortunately, they are referred after an attempt without magnification to remove a broken file. So they did a perforation, then they referred the case. So now it's much more complicated. So I advise you, first of all, to have a magnification.
Wait a minute, Talal. There are. Wait a minute. Sometimes the internet is dropping.
Yes, can you hear me now?
Yes, I can hear you. A few seconds ago, we couldn't hear you. Can you please repeat
No,
that?
because I received the call for that reason, so we have this issue. So we were talking about to have a magnification. It's very important to see the broken file and to see it through the microscope. This is very important in order to do so. You will tell me, okay, it's frustrating answer. I don't have a microscope. It will have a very huge budget. I will tell you something. In the previous time, I remember a lot of clinics, they didn't have X-rays. So after that, they had an X-ray. So the things are changing. You will reach a time that a microscope is not an option, even if you are freshly graduated or you are planning to open your clinic. You have to think about the magnification tool or the microscope as a main part of your practice, like the ultrasonics, like they say the X-ray, like lasers, like anything. You have to have it in your clinic. Also, you have to think about the microscope. And once you start working with microscope, you will regret each minute you did practice dentistry without magnification. So it is a must to have a magnification, and then it's a must to have an ultrasonics. And we know that it's very important now. The use of ultrasonics in endodontics is expanding a lot. And in the past, we used an ultrasonic only for scaling, but now we understand that we have so many designs, we have so many tips that can help us to do so many things in a minimally invasive way, in too much preservation of the structure, which and you speak about a lot about it, and you're also you host a lot of speakers speaking about the importance of pericervical dentine and the saving of tooth structure for the survival of the tooth. So it is something not negotiable. You have to have this magnification, and you have to start working with ultrasonics in a proper way. And also, this is another issue. So
Talal,
now sorry.
Dear Talal, they're also asking, can we remove the file by using loupes instead of microscope? Because the students or PhD students don't always have microscope. I think it's difficult to remove it by loupe, but what do you want to say about that?
Unless you have the broken file emanating from the orifice of the canal at least 1 millimeter, and you have a loupe magnification of 5, you will not be able to remove a broken file. We have to admit, my friend, I'm sorry for this, but it is a reality. This is the reality. Don't try to do it. And by the way, it is not something difficult. Once you practice the removal of a broken file, and I don't know if you agree with me, Mustafa, or not, you will find the broken file removal much more easier comparing with bypass.
Yes, I totally agree with you.
Yes. This is something very important, and you will be enjoying more what you are doing. So you use a loupe if you have a broken file at the orifice and you can see it, then you can try to play with it. Otherwise, if it is inside the orifice of the canal, I don't advise to do so. And if you have any cases removed by this, it could be by chance, or it could be succeeded this time. We are afraid that next time we will remove too much tooth structure.
Yeah. And dear Talal, they're asking us the brand of ultrasonics. We are mainly the lecturers of Woodpecker. So we always, I always use Woodpecker products, and I'm really very satisfied with their ultrasonic device. And you have also have your own ultrasonic tips from Woodpecker. What do you want to say about these tips and your Woodpecker ultrasonic device?
Okay, for sure. using the ultrasonics is not something that you can, and thank you very much for this question, because we are having a lot of problems, especially for the new dentists starting to use the ultrasonics tips, endodontic tips. They will start to have, oh my God, I'm using these tips and I have a lot of fracture of this ultrasonic tips, so I will quit using it. I am frustrated, I don't want to do so, and so on. It is also very important to know how to use the ultrasonic tips for endodontic purposes. Based on what? Based on using good quality brands of ultrasonics, which for sure Woodpecker, DTE, like the D600 one of, I believe, one of the very good ultrasonic devices worldwide. I advise everyone to try it. D600, very good. So you have, on the basis of having good ultrasonics, which has a endodontic options. Because if you use the ultrasonics on your scaler, on your unit, dental unit, it is different. It will give you too much power. You will break the file. You will break the point. Yes. And also the type of the movement, it's magnetostrictive, whereas the movement for endodontic is piezoelectric, linear, back and forth. This is movement, the unit is elliptical. So it's a different concept. You have to have an ultrasonics unit with a good brand, with endodontic function, and then you have to understand how to use them. Now going for the tips. And this was initiated, the main idea for the Dr.Talal Endo Kit. Why I developed this Dr.Talal Endo Kit in association with Woodpecker. First of all, Woodpecker is worldwide company, so it can distribute worldwide any product. So everyone worldwide will have the access to have this kit. On the other hand, and because of so many tips on the market from so many companies, dentists are confused. Yes. They are not well educated in the university about the proper use of ultrasonics. Not all the universities are having this curriculum in their maybe for the postgrad, not the undergrad. So it's very important to understand. So the dentist will go to the market. He will have a lot of options. He will have a lot of variety. He will not understand how to use them. So the main idea was to make a collection of tips that give us about 80 to 90% of endodontic uses, whether you are using the magnification of microscope or the magnification of a loop or without a magnification. We have to understand that the removal of the broken file is a must to have a magnification of microscope with the use of ultrasonic. But if you want to use the ultrasonic, it is not a must to have a microscope, but it will be better. But it is not a must. For example, the refinement of the access cavity. After opening the access cavity and trying to refine the access cavity in order to preserve the pericervical dentine, you can do it without magnification. So this is a small example. By having this kit, by 6 tips, you will be able to do so many things. You will be able to play so many games with endodontics. So this was the main idea. We modify some tips in order to be used for example, the fiber post removal, the bulb stone removal, refinement of access cavity, even in restorative dentistry, removal of deep composite restorations. This is something very important also. Yeah, and the removal of the broken file, and also removing of calcification in the coronal part. So all this application, now you can have it, and you can do it in much more easier way if you have special designs of different tips in order to do what you are intended to do. So for that, I created this tip, which is called Dr.Talal Endo Kit.
Talal, they're asking how many times can they use this tip, for example, for a routine clinical practice?
This is also another good question. It depends on the way you are using it. It depends on the type of the ultrasonics. For example, the thinner ultrasonic tips, they will last for less time comparing with the wider or the thicker tips. And also you understand that the thicker can do more duty, can remove more to structure. So if you, for example, subject high power for ultrasonic, for a thin ultrasonic tip, it will break. One. Another way, another reason of separation of ultrasonic, how do you use it? You have to understand, and this is very important, my friend, it's a learning curve and can be understood after doing a lot of cases. how much the pressure you have to apply over the tooth structure when you are activating with ultrasonics. Because if you push too much,
yes,
you will not cut. You will try to elevate the power settings because you feel that your tip is not good, is not cutting.
yes, that's so important.
Why? Because you are pushing
Too
too
much.
much and you are removing the vibration of the ultrasound.
Great,
So
great
you
instructions.
increase the power setting, so you will increase the heat accumulation, then you have a fracture. Then you will say this tip from this company is not good. Otherwise,
Great
you are not
instruction,
doing
yes.
it correctly.
Yes.
On
Now,
the other hand, I'm sorry,
yeah.
let me complete this. On the other hand, if you push or you touch lightly, you don't touch well the tooth structure, the ultrasonic will vibrate without cutting. Why?
Yeah.
Because you are not touching, you are afraid, so you stay high, far from the tooth structure, it will vibrate, it will not cut. But guess what? It will have a cyclic fatigue. Going back and forth, it's a cyclic fatigue. The same way some broken files break inside the root canal. So you will break a file. So my advice to you, and as a summary for this point, do moderate touch. And it's a learning curve. You need, whenever you hear the sound of cutting is getting increased, this means that you're having the maximum cutting efficiency. If you apply your ultrasonic tip over the tooth structure and you don't hear the sound of cutting, for sure we cut without irrigation because we want to see. Then after that we do irrigation to minimize the heat. But you need to hear the sound. If you don't hear the sound, this means that you are either pushing too much or you are not pushing, so you are not getting benefits. And both of that, you are going to break the file. So it's how to use them and the thickness of the ultrasound.
Great instructions, Talal. Really great instructions. Now, last 10 minutes and a few more questions here, Talal. One is asking, which is most difficult to remove from the root canal? Key file, hash file, lentillo, NITO instrument, rotary or reciprocating NITO instrument? For example, you shared a case of removing lentillo a few hours ago. Which one is the most challenging for you?
First of all, let's speak about manual file comparing with rotary files. Usually, I'm not saying always, usually, the manual file breaks inside the root canal due to torsional stress. And the rotary file breaks inside the root canal due to cyclic fatigue. Most likely, not 100%. But why? Because we are forcing our K file, taper 10, with a narrow canal. So when it breaks, this means that it is engaged, high engagement, which will make the removal much more difficult comparing with the file that was broken due to cyclic fatigue. This is in general if we compare the manual file to a rotary file. Let's stick to the manual files. We have the K files, we have the headstrong files. The K files, they rotate while they are penetrating the canal, and then they will break. But so we can have a torsional stress with some sort of cyclic fatigue. Headstrong files are push and pull movement. So I believe the K file will have much more engagement with the walls of the canal comparing with H files, which make the removal of the K file much more difficult. For that reason, my friend, you see most of the cases of the bypass is done for a file broken of K files. Why? First of all, they are difficult to be removed. Second, we have potential for more space because it's a 2%. And you know, understand that the canal could be oval in shape. So we can delay much more. So dentists who are advocating and pushing for a bypass as an alternative or the solo solution for the broken file, look for their cases. Most of their cases, they are bypassing a 2%. If you want to bypass a 6%, it will be a nightmare. Okay, yes. Let's go for rotary files. And if you want to compare rotary files between each other, the lentulo, the case of the lentulo, which I did it or I showed it today. Actually, the lentular spiral are very easy to bypass and to be removed. Why? Because they are not engaged with the wall of the canal. We use the lentular spiral, for example, to apply cement or to apply dressing or something. So the canal is already enlarged. But the problem is they are not using the rubber stopper, and they are using with a high rotation. Once they go beyond the curve, it will break due to cyclic fatigue. So it's very important, try to catch it with a loop or with any technique and to remove it, not with ultrasonics. We don't use ultrasonics for loop because the lentular spiral. The lentular spiral is not engaged. We use ultrasonics whenever we have an engagement in order to free the engagement of the file with the canal walls to be able to remove it. So if it's purely broken due to cyclic fatigue, so you triffle around it, you catch it, and you remove it. But if you compare with the rotation file and the reciprocation files, the rotation files actually will have much more engagement with the reciprocation. We know that the reciprocation movement will have some freedom, will make some free movement to minimize cyclic fatigue. So removal of the rotation, or let's say file which is broken due to rotation, comparing with wave one gold or reciproc, the reciproc will be much more easier. And also I will extend about the metallurgy. The difference in the metal of the rotary files. The austenitic file are much more difficult to be removed comparing with heat-treated file or martensitic file. For example, if you have a protaper universal, it is much more difficult to be removed comparing with let's say protaper gold, because you need to remove much more to structure for austenitic, because they will tend to straighten, whereas the heat-treated file, you can adjust them. But also, we know that the incidence of separation will be much more with the rotation comparing with the reciprocation. But it is not only always, because sometimes even the rotation files, incidence files separation will be less comparing with the reciprocation. And this is something a little bit complicated related to the martensitic phase while rotation in the body temperature. We know that in the body temperature, we have increase of the heat. So even the heat-treated file will tend to have some austenicity inside the root canal in order to cut. But some rotary files, the transformation martensitic degree will be much more higher. So they will keep rotating in martensitic phase, comparing with the martensitic phase that reciprocate in austenitic. I believe you did something about it. You did something, you and Taha, I believe,
yes,
in 2017.
Yes.
I read something about it. So I send my regards to Taha also.
We are also sending our best regards to Taha. And dear Talal, last question. Do we have to buy a loop device or besides microscope and ultrasonics?
Okay. Very good question to conclude this discussion about it. We have to understand something very important. The removal of broken file, for sure, I totally understand. We will not be able to give all the ideas about the removal of broken file through 30 minutes or 35 minutes. It's a very, very long topic to discuss about. We have so many techniques. We have the ultrasonic, we have the grasping, we have the loop, we have the tube, the modified tube, the tube and cements. We have so many techniques. Most likely we are using the ultrasonics, but we don't have to insist using the ultrasonics. Some cases, ultrasonics is very important at the beginning. Let's say in the preparation step, not in the removal step. Whereas the removal step has to be with the loop. And the loop, actually it's a wire. And most likely I use them for cases where for longer broken file, more than 4 millimeters, 4.5 millimeters, I use the loop to remove them. Or even for shorter ultrasonic tips, for shorter broken file, if the ultrasonics was not able to remove them. And this is most likely in cases of more than 30-degree curvature of the canal. So even in shorter file, I use a loop. In longer file, my first choice is to go for a loop. So In order to master the removal of broken file, you have to have all the techniques, the ultrasonics, the grasping technique, the loop technique, and then you choose according to the case. Because we don't want to make the removal on the same time to destroy the tooth. You know, we have a statement here that the operation, the surgery was successful, but the patient died. Okay, so we don't want to do the same. Okay, I'm successful, I remove the broken file, let's post on Facebook, let's do blah blah blah. We need to understand when to remove them and the correct way to remove them in order to save more tooth structure, which will improve the prognosis of the tooth.
Dear Talal, I made you really tired, but this was like a mini congress. Thank you very much for your great information. It was my great honor to host you. Thank you very, very much for sharing your valuable time. I know you are very busy, but you didn't break me. You accepted my invitation. I'm so grateful for that. And also my students, my followers are grateful because I'm getting many thank you messages from them. And thank you very much for sharing your valuable contribution. What do you want to say before closing the ENDOTALKS?
Thank you very much, my friend. Really, we are friends. You are my brother, and always I enjoy when traveling worldwide. We meet a lot in congresses, so it is something very important for me to be on your platform. It is me that I want to thank you for giving me this opportunity. I would like to extend my thanks to all the followers that they are following, and they are. I know that we are in the mid of the day. Usually we go in the evening time, so people will be more free, even though we have a lot of followers that are following our presentation. Thank you very much for giving me this chance. And I will tell you something for all the students and the freshly graduate. Removal of a broken file is something not difficult. Believe me, it is as a piece of cake. But after you follow the correct way, you have the equipment, and then you have the passion. It's very important. You must have the passion in order to love this, and you will be able to get better prognosis for the case because you will be able to clean everything with a better outcome.
Thank you very much, dear Talal. Have a nice day. I am sending my best regards to you and your family, and hope to see you soon.
My friend, me too. Hope to see you soon. Thank you again for this invitation.
Thank you very much for this little mini congress, and goodbye to everyone from ENDOTALKS Study Club. Bye bye, dear Talal.
Bye bye, my friend. Goodbye.